Hi everyone, I'm going to show you how to draw up medication out of a vial. So you are going to first cleanse off the area that you're going to be working at. So get like a Clorox wipe or anything you got and you're going to clean your surface, okay? Then you're going to wash your hands with soap and water or hand sanitizer. So because this is a clean process, you want everything to be clean, okay? So once you've done that, you're going to gather all your supplies. So you really just need about three things. You need the medication, you're going to need your alcohol swabs, okay? And you're going to need your insulin syringes. So once you have all of that, you're going to get your medication, whoops, and you're going to make sure that it's your medication. You're going to make sure that it's the medication you're supposed to be on. So if I'm taking tirzepatide, my medication should say tirzepatide. If I'm taking semaglutide, it should say semaglutide, okay? So it always comes, when you first get the vial, it always comes like with a little topper, either like a foil piece that you can just peel off or something else. So you take that off and you can expose the gray rubber stopper here. So you're gonna get your alcohol swab. And I always save it. Once I'm done cleaning my vial, I use the same swab to clean my skin where I'm doing the injection. So you want to clean the top here, the gray area. You want to apply some pressure and just rub it around for about 5 or 10 seconds, okay? So once that is done, you're gonna put that down. And then you're gonna grab your insulin syringes. So when you first get them, they'll be in a pack of 10. You just open it up, grab a syringe. This is the top where the needle is, and this is the bottom where the plunger is. So take this off, you don't need it. So you're gonna take that off, and then you're gonna look at your directions. And if it says inject 50 units of medication, you are going to draw up 50 units of air in your syringe. So that means that you're gonna pull this plunger down until the top of that black piece is at the 50 mark, okay? If you're injecting 20 units, then you're gonna go to the 20 unit line where the top of the black area is, okay? And then you are going to take the lid off, expose the needle, get the medication vial that you just cleaned, okay? You're going to puncture the gray area right in the middle. So just like that, you're going to put the air in, so push it down. Then you're gonna turn it upside down. And then I hold it like this, where I and the first time you do it, it's gonna be very awkward. You're gonna be like, what's going on? The more you do it, the easier it gets, okay? So I just use my finger to kind of pull down. You do wanna go slowly, because if you go fast, you're gonna get a bunch of air in that needle, which you don't want. So you're gonna pull it down slowly. I'm gonna inject 50 units. So I'm gonna go a little bit beyond the 50 unit mark, okay? And then I'm going to just push it up right where the top of the black area is on that 50 mark line. Now, sometimes you may get some air bubbles. One little tiny air bubble isn't such a big deal, but if you have more, then we need to get rid of those. So typically what I do is I pull back, and then you can kind of just tap it, and usually those bubbles will float up, and then you can just slowly push it back into the vial. Okay, again, like right now I have a tiny little air bubble. That's perfectly normal. If you have a large bubble, you do want to get rid of that, because that means you're not getting as much medication as you're supposed to be getting. All right, so yeah, so I got the 50 units of medication, so I can turn it upside down, take my needle out, and inject, okay? Also, as you're getting low in your vial, it's not going to cover the needle as well, right? So the medication should always be over the needle. So when you don't have a lot of medication in there, what you want to do is you want to pull the needle out just a little bit, not all the way, just a little bit, and then start pulling back on the plunger. This is gonna get that little bit of medication that's way down at the bottom. You may even try to tilt the needle a little bit, not too much because you don't want to bend it, but just tilt it a little bit, and sometimes that can get the little bits out of there, okay? That's pretty much it. So the first 1 or 2 times, you know, you'll probably be watching this video to say, how did she do that? Then you'll be a pro. If you're really having a hard time, give us a call or come into the office with your medication and we can walk you through it again. But yeah, so enjoy.